Hi, I'm answering week 6, chapter 11 questions. So, what are some ways that miscommunication or communication errors can lead to malpractice in healthcare? I think miscommunication can lead to malpractice when important information isn't shared clearly between healthcare providers or with patients. For an example, a patient could receive the wrong medication, they could misunderstand discharge instructions or experience a delay in treatment because of poor communication. Excuse me. If a provider fails to explain a diagnosis, or a doctor doesn't receive updated orders, the patient's safety can be put at risk, which is why good communication is essential because even a small misunderstanding can result in serious medical errors. Should a provider be allowed to practice with a record of malpractice? Why or why not? I really think it depends on the circumstances. Not every malpractice case means the provider is careless or unqualified, since some cases involve honest mistakes or unexpected complications. If the provider has learned from the incident or the problem, if extended training is needed and continues to provide a safe, high quality care, they should be allowed to practice again. However, if there's a pattern of repeated negligence or behavior that puts patients at risk, then stricter consequences should be in place to protect future patients. And lastly, should informed consent be used as a shield of legal liability in medical malpractice? Why not? I don't think informed consent should completely protect healthcare providers from malpractice claims, because informed consent is important because it helps patients understand the risks, benefits, and alternatives before agreeing to a treatment. However, signing a consent form does not give a provider permission to act negligently or provide care below the accepted standard. Providers should still be held accountable if a preventable error occurs, even if the patient agreed to the procedure beforehand.